The topic of our assignment is on post-traumatic stress disorder, PTSD, on cognitive neuroscience. Our objective in the study are to broaden our knowledge on the subject and its characteristics. Second, to be motivated to work together to discover new information. We find the study on PTSD interesting because it allows us to get a better understanding of situations of people diagnosed with PTSD. It allows us to spread awareness of how PTSD can be a problem to those facing it. It also is a crucial topic to not be aware about. Furthermore, this topic is relevant to our study on cognitive neuroscience because post-traumatic stress disorder is a condition found in the brain. In this report, we can get a better understanding on what is PTSD, what are the effects of PTSD, the connection of PTSD and connection, and a brief MRI assessment of PTSD patients.
What is post-traumatic stress disorder, PTSD? PTSD is a mental condition in which a person will experience a panic attack triggered by the trauma of past experiences. It is also a psychiatric disorder that occurs in people who experience or witness traumatic events, such as natural disasters, serious accidents, war or battles, and acts of terrorism. PTSD can indeed happen to everyone and no exception. For example, can happen to any ethnicity, culture, and nationality and at all ages such as children, adolescents, adults, and the elderly. There are several types of symptoms for people with PTSD. First, disturbances in memory. People with PTSD will have difficulty forgetting an event that causes them trauma no matter how much effort they put into erasing the memory. Next, avoidance, which causes PTSD suffer to do everything possible to forget the stay away from things related to the trauma they have experienced. Besides that, change in thinking that become more negative. After the trauma they experience, their way of thinking will change as they always think negatively of themselves and others, and it is difficult to think positively and cause them to feel they have no further. Then, change in physical and emotional reactions. They always feel overly alert and suspicious because they are easily startled or scared.
How would post-traumatic stress disorder affect on our brain? First, it will affect on our amygdala, which is act as an alarm system. For a PTSD patient, it would overactive than a normal people. Because this case, it will call it as the hyperactivity of amygdala. It will make them overly respond to the harmless stimuli, intrusive and frequent flashback. They were triggered if hearing a word or listening to the sound that might seem familiar with their traumatic experiences. For example, when the car backfired, the person with PTSD will immediately panic. Second, it will affect on our prefrontal cortex, which is act as our brake system. Certain traumatic experiences that have been faced by the PTSD patient cause changes in the ventromedial prefrontal cortex part to be lasting. It automatically make this part of the brain do not function in the time when PTSD patients need because it cannot reduce their overly negative emotions when facing some stimuli. Third, it will affect on our hippocampus, which is act as our hard drive. The hippocampus did not function for the PTSD patient because due to the losing the ability to differentiate between their past and present experiences or correctly clarify the environmental details. They were unable to minimize the involvement of their past memory because of their mechanism involved a terrible stress response when faced with the environment that resembled their past traumatic events. For example, the victim with the sexual assault scared whenever they were at the parking place because she was once raped at the similar place.
I will explain regarding on how does post-traumatic stress disorder or PTSD affect a person in daily life. PTSD occurs in the weeks and months after a traumatic incident whenever the effects of trauma continue or worsen. Extreme anxiety, nightmares, and lingering memories of the incident, such as violence in a relationship, childhood abuse, and many more are all common side effects. Post-trauma, physical symptoms, or disability, getting no help after the trauma, and coping with some other stress factors such as financial problems are all contributors to the development of PTSD. What are the effects on society? People and the community are both affected by PTSD. They encounter personal problems, family issues, and lower average earnings. Women were more likely than men to experience PTSD after most stressful events. Trauma perceived after the triggering trauma incidents, such as adulthood stressful events, has been linked to a higher risk of PTSD. Children who have been abused may experience PTSD symptoms, which may make it difficult for them to work as responsible adults and tend to be in unhealthy adult future relationships. What are the effects on relationships? PTSD can worsen relationships in a variety of ways, including a lack of emotional stability, a lack of interest in family events, insecure contact, increased dependence on a spouse, and excessive frustration. PTSD is a severe mental illness. Positive relationships are beneficial to everyone's health, and negative relationships could cause PTSD healing very difficult. Continuing to support a partner can provide them with spaces they require to seek treatment, whereas giving encouragement will reassure them that they are loved and cared for.
The connection of PTSD on cognition. The effects of post-traumatic stress disorders on parts of the brain such as amygdala, prefrontal cortex, and hippocampus. Our amygdala set off our so-called alarm in our brain. When we are experiencing an unpleasant event, it will send off a signal which is known as the fight or flight response. This happens because our brain wants us to keep us safe from danger, therefore it sends out the signal to keep us safe. However, for those with PTSD, they tend to overreact, which will make them panic. Secondly is our prefrontal cortex. Our prefrontal cortex is located in the front part of our neocortex. It helps us to think of a decision fully, to compare how we are thinking, and to restrict ourselves when we finally realize that something that we are afraid of at first are not as dangerous as we think it is. For those with PTSD, the prefrontal cortex fails to do its job most of the time. Thirdly is hippocampus. Our hippocampus is the center of our brain. In another word, it's like a computer hard drive which can store a lot of data. After experiencing a trauma, our hippocampus remember the scene from the event with pinpoint accuracy and work to make the scene appear logical and rational to us. However, because of a trauma, which is an overwhelming event, all of the information we have in our brain cannot be processed correctly.
Now, I will explain the effect of post-traumatic stress disorder on the brain structure. A study has been published in September 2013 by a group of neuroscientists in China, and this study shows that there has been a changing in the brain structure due to the impacts of post-traumatic stress disorder. And the changing is happening at the specific area called the left superior parietal lobes, where it was found to be decreasing. This study was conducted by using 33 survivors of a mine disaster. 12 of them suffer from the PTSD due to the accident. 7 of them suffer from PTSD with improved symptoms, and 40 of them who experienced the incident but did not suffer from PTSD. The findings show there has been a lost volume at a specific area in the brains, the left and the right hemisphere in the cortex. The study also showed that the brain's gray matter in the occipital, parental and the prefrontal also has been damaged by PTSD. The study concludes that by balancing this specific area will have the potential to help those who suffer from PTSD.
Assessments from MRI scans that show a brain abnormality. According to Holcomb 2011, brain abnormality is an unusual feature of the brain shape, function, or biochemical levels. Differences in abnormalities differ hugely from diseases, toxics, and traumatic disorders, which means different results for different PTSD patients. Firstly, according to Bremer 2006, studies have shown smaller hippocampal volumes to be found connected with the trauma-related psychiatric disorders in the appearance of psychological trauma. Second, patients who are female have smaller anterior chin cingulate volume if they are suffering from abuse and PTSD relative to controls, Bremer 2006.